Okay, if you are not a presenter, would you please mute yourself? Our next presentation is Systemic Optimism Amid the Burnout, presented by the Family Therapy in Schools Topical Interest Network. There are 7 members of this network that I'm going to introduce now. Kathleen Laundy is a licensed psychologist and family therapist who has treated children and families and consulted in schools for over 40 years. She is clinical faculty at Central Connecticut State University. She's also an AAMFT, American Association for Marriage and Family Therapy, clinical fellow and approved supervisor. She is a fellow of the Oxford Symposium in School-Based Family Counseling, and she is the past chair of the Family Therapy in Schools Topical Interest Network of the AAMFT. In 2017, she was awarded the Outstanding Contribution to School-Based Family Counseling at the Oxford Symposium at Brasenose College. Our next member is Erin Cushing, MA LMFT. She serves as the chair for the AAMFT Family Therapy in Schools Topical Interest Network. Erin is a licensed marriage and family therapist and approved supervisor in the state of Connecticut, where she maintains a small private practice, and she has been a clinical faculty member in the Marriage and Family Therapy Graduate Program at Southern Connecticut State University since 2014. Our next member is Rambo, PhD. She has been a professor of family therapy for 3 decades. She is a consultant to the 6th largest school district in the United States. Her research and publications center around alternatives for at-risk youth and prevention of school violence. Our next member is Michael Rankin, LMFT, MA, and he is the treasurer of the Topical Interest Network. And Mike is a graduate of Louisville Presbyterian Seminary MFT program, graduating in 1995. Mike has been in private practice since 2003. He was the former executive director of KAMFT from 2003 to 2011. He has made several presentations with Dale Bertram and Tony Watkins at AAMFT, TAMFT, and Ericksonian conferences. He is also a partner of interactive CET training with Dale Bertram, PhD, and Tony Watkins, MA. Mike and Dale Bertram are completing a book on Ericksonian supervision. Both are hoping to start writing their next book on the influence of Milton Erickson in developing the marriage and family therapy profession. Lately, Mike is also the legislative liaison for Kentucky Interest Network, which is part of the American Association of Marriage and Family Therapy. Mike works on behalf of all MFTs in Kentucky. Eileen Klima is our next member, MS. Eileen received a Bachelor of Arts degree in psychology from California State University, Northridge in 1990, and a Master of Arts degree in psychology with an emphasis in school psychology in 1993. And then in 2006, Eileen completed a second Master's of Arts degree in psychology with an emphasis in marriage and family therapy, both degrees from Humboldt State University. Our next member is Sandi Cox, LMFT. Sandi is currently a mental health therapist directly hired by the Lebanon Community School District in Lebanon, Oregon. For the past 2 years, she has served students in the high school setting and further developed mental health services and support throughout the district. Initially in her career, Sandi worked 4 years for a nonprofit agency partnering with high schools to provide direct care to students and their families. Sandi then entered the community outpatient and group practice sectors for 15 years to specialize working with the deaf population along with school-based children and their families. Sandi serves as a member at large of the Family Therapy in Schools Topical Interest Network of the AAMFT. And our last member is Kimberly Welk, LMFT. Kimberly is an AAMFT approved supervisor and owner of Kimberly Welk and Associates Family Therapy Center. The acronym is KWAFTC in Green Bay, Wisconsin. She is a graduate of the University of Wisconsin-Stout, Menominee, Wisconsin, and a member of the AAMFT and AAMFT school-based mental health topical interest network. Her clinic has recently been awarded Wisconsin Governor Tony Evers' Behavioral Health Telehealth Partnership Grant to continue to develop atypical provision of mental health in the rural underserved areas of Northeast Wisconsin. Kim is the developer of the KWAFTC school-based mental health and telehealth programs, which now serve 10 school districts, covering 17 schools and 7 counties in the rural, underserved areas of Northeast Wisconsin. Kim's unique approach to establishing and staffing her school-based mental health program has allowed this program to provide effective, affordable, and convenient mental health services. She will highlight the topic of providing school-based mental health and telehealth services as a private agency. Would you please give this team a warm welcome?
Thank you so much for the warm welcome. Good morning, good afternoon, good evening. I hope I'm covering everyone's time zones. It is wonderful to be back with you virtually, and we are hopeful and excited to be back in person next year. So Brian just provided a wonderful overview for us, but I will just quickly run through our introductions again. I'm again Erin Cushing, the current chair of our organization, and I'm in Connecticut. Dr. Kathleen Laundy is our past chair and joins us from Connecticut and Florida. Dr. Rambo is our chair-elect and comes to us from Florida. Mr. Mike Rankin is our treasurer, hailing from the state of Kentucky. Ms. Eileen Klima comes to us as a member at large and family team liaison from Northern California. Sandi Cox serves us as a member at large from Oregon, and a huge shout out to Sandi because she's actually in Hawaii right now and up at 4 a.m. for this presentation. So a large appreciation to her for getting up quite so early. And Kim Welk joins us as a member at large from Wisconsin. So we are a very diverse group within the United States. And as you will see during the course of our presentation this afternoon, I should say, our presentation really does focus on national issues and national needs within the United States. So some of what we will be talking about might pertain to some international issues and flavors that you all can relate to. Some of it is going to relate very much to those things that are very much of a US-based concern or issue, and that we have been identifying and working through within our own national ranks. So I will turn it over now to Sandi.
Hi. So as we are looking at providing optimism, we're first wanting to just address some of the stressors that we have faced, and many of you have already probably recognized the impact of the COVID pandemic, which brought about a lot of uncertainty and change. There was job and financial insecurity. We are looking at illness and health-related concerns to the pandemic. And I think most importantly, there was a loss of connection, which created a lot of isolation for many of us, all of us. And that's just not how we function as beings. Specifically to schools, we had, there was distance or remote learning, which quickly identified the lack of access to education, technology, services, and supports for staff and students and parents. There was a lot of use of technology without having training or really having the skills and the development to do so. And then topped off with overwhelm with meeting individual needs academically, emotionally, and behaviorally, which only increased with the return back to in-person learning. And then next, there's natural disasters. I think increasingly in the news, we're seeing floods, fires, heat waves, and cold snaps, and drought, which is impacting the mental health and our sense of stability and security in having our basic needs met.
Hi, and I'm going to talk to you about social justice issues and tensions and the effects of school violence and collective burnout. Many of the things that Sandi was talking about affected people worldwide, certainly the COVID-19 pandemic, increases in natural disasters. Social justice issues and tensions are also a factor worldwide. Many countries, including our own, are coming to terms with painful history. In the United States, in recent years, the George Floyd murder and the resulting protests and demonstrations have affected the entire country, but also certainly the school system. And we are still looking at coming to terms with patterns of historic racism, oppression, and discrimination in school suspensions. In addition, I need to bring up a problem that is a particularly United States problem. Between the years of 2009 and 2018, the United States experienced 288 school shootings. The next highest country in the world was Mexico with 8. There's a big difference between 288 and 8. And since 2018, there have been many more school shootings in the United States. A conservative estimate is that we have 57 to 60 times more school shootings than any other country in the world. What does that have to do with? That has to do with some unique United States factors, our gun culture, our cultural emphasis on individual autonomy, which includes the right of parents to decline mental health treatment for their children, and the continuing stigma around mental health treatment, the sense that everybody ought to be able to just pull up their bootstraps and make it work. So this is a continuing issue for us. It's a persistent problem, which we have made many efforts to solve, but which continues to be a problem, most recently in the news with the Uvalde school shooting. The need to have active school shooter drills that all children in the United States participate in, the continuing discussion around school shootings, and the fear it affects teachers as well as students, and casts a pall in many ways over the entire school system. And I'm going to move along to Dr. Laundy to talk about some optimism.
Clearly, we are going through a very complex time in our culture as well as many other cultures around the world. However, we see some systemic opportunities and some really optimism among some of the burnout that healthcare professionals are experiencing. The first is that particularly in the United States, Anne had talked about there being a focus on individualized, more of a Eurocentric orientation to healthcare and education. People are now, because of these variables that are happening, are beginning to think more systemically in ways that we hadn't before. We are looking at, excuse me, we are looking at cultural implications. We are looking at healthcare implications. We are beginning to see, number two, the integration of physical and mental health services. And that if kids do not get access to appropriate mental health services, they develop physiological issues. And if people that have physiological issues don't get treatment, they develop mental health issues. And the integration is really beginning to happen in this country in ways that it hasn't before. And along with that, we have 6 different licensed mental health groups in the United States. And we have seen truly an increased set of opportunities for collaborative, multidisciplinary support in schools for all 6 licensed mental health professionals. Several years ago, family therapists got school certification in some of our states. And we are also partnering with counselors from other states who are, we're 2 of the newest mental health groups, and as such are more universally systemically trained. So we're seeing just a growth in that, as well as a growth in national support for school-based mental health services. So we just had some wonderful news this week from the Biden-Harris administration that there have been 2 new actions about addressing the youth mental health crisis, along with $300 million infused into various initiatives to offer support. So it really is growing, and there really is reason for systemic optimism among the burnout that many people are feeling. Erin will now talk about, well, we will talk about the 3 ways school-based family counselors are joining school teams.
Thank you, Kathy. So I'll just quickly introduce this and then turn it over to my colleagues. So we have talked about this before here at Oxford, but 3 ways in the United States specifically that school counselors or family-based school counselors are joining schools are through direct hire and being licensed or credentialed or just directly hired into school systems themselves. In terms of, they've also been working through private practice collaborations and different various agency partnerships. So I will let each of our members speak a little bit more about those.
Yeah, so the first opportunity is being a direct hire of the school districts. And we're seeing more opportunities and trends in starting to work in those schools straight from graduate school. There is a hiring variation, like Erin and Kathleen said, about hiring either pre-licensed clinicians, licensed clinicians, or needing a special certification. So that does vary across the country. But it also just really provides an ease of access for students. We're able to provide mental health services and supports for all students through integration work and embedding them either into the one-on-one therapeutic setting, providing groups, or being able to enter entire classrooms to be able to address mental health supports and needs. We're able to also provide education and training, consultation, and support on site for educators, staff, and the parents that directly impacts those students as well. So we're able to be there all the time and be that support for students and staff throughout the day.
Well, my name is Mike Rankin, and I'm a licensed, as said earlier, marriage and family therapist, and I've been working in private practice for over 17 years. And I work with school personnel. I've talked to teachers and counselors in the schools, and there is systemic optimism, I think, in terms of working with students in the schools, personnel, in that the multidisciplinary work that Kathleen Laundy was talking about is helping and will continue to help so that there are less students who fall through the cracks. A lot of times in my practice, parents bring their students to see me and they complain about the school, and some of the children get lost in the school system and they lose out on their own growth, their own development, learning to be how to interact with others, and creating a lot of disresiliency. So they're looking for that strength and they don't always have it. And I think this multidisciplinary approach is an excellent approach and creates a lot of optimism in the future of what we can do. And part of that is, as a group, as the Kentucky Interest Network of Family Therapists in Schools is in a multidisciplinary way with many other mental health professionals can help and carry on the work of what Margaret Mead, a great anthropologist, said. She said, never forget that a few committed citizens can change the world. Indeed, that is the only way it happens. So these school efforts and endeavors of what's going on in the United States and around the world is very optimistic for all of us. So thank you.
Thank you, Mike. First of all, I want to thank all of you for inviting me to be a part of this really important discussion. I'm excited to be able to talk about how we can provide systemic optimism in school-based mental health through the private practice lens. And today I want to talk about 3 specific areas that I think do provide that most optimism and even viability for private practice agencies. So first of all, under our model, we know that there's a multi-systemic and multi-tiered approach. We know that it takes about a 3 to 5 year commitment to our communities so that they see that we're giving buy-in. We're at least 2 hours away from some of our communities providing telehealth. And we have to work very hard to develop relationships with school administration, the employees, the educators, the support staff, all the way to the janitors. We need to make sure that parents and guardians are involved, and it being such a distance, sometimes that's a difficult thing. Funding resources throughout the community, as we talked earlier, when we bring even the IFS systems in to work with the teachers, how are we providing funding for those sources to be able to do that type of work? And most importantly, from our initial level, is developing those relationships with the children. Our specific program started as a school-based mental health program in 2019, and we serviced 4 schools, districts, and 8 different schools. Throughout the COVID pandemic, this has now transitioned to a school-based telehealth program for us, and it's one of the only programs in our area that I'm aware of. We now service 10 school districts, 17 schools, and have 6 districts on our wait list. So it's a growing and exciting area for us. One of our biggest challenges that we have faced is how to take this opportunity and find providers, with the current worker shortage that we feel exists here in the US. And because what we have done or understood is that because our school districts are socioeconomically deprived, the insurance is mostly Medicaid or state funded insurance, which allows us to adapt our program to both master's level and postgraduate level students working on their licensure. This allows for them to have to get the hours that are required, but also get experience in the up and coming fields of both telehealth and school-based mental health. Finally, financially, we have seen federal and state funding beginning to open up for private practice, private agencies. It's the first time ever that grants have been available to us. As was mentioned previously, President Biden and Vice President Harris's announcement is going to allow increased opportunities. And here in Wisconsin, we've already seen that begin to happen. Our clinic itself was the recipient of a $100,000 grant designed to allow us to set up trauma-sensitive sites within our schools. So in those very specific, thank you, Kathy, those very specific rooms that are certified as a clinic, we can make sure that technology is the most developed. We can make sure that the room is decored to be very trauma sensitive, so it's not sterile or it's not a janitor's closet. And we can provide training to our staff. All of them will be certified as school-based telehealth providers for children and adolescents, furthering our ability to ensure that we're providing direct services for those needs. Another thing in the state of Wisconsin, our State Department of Public Instruction puts out a framework for school-based mental health every year. The new one that came out this year is very systemically based, and I'm very excited to see that and how it will develop for our other licensures here within the state. And finally, the development of these programs in our clinic and other small clinics around the area is really starting to attract attention. of both individuals and other larger healthcare agencies, because telehealth is the department to grow, or school-based mental health is the department to grow. In 2022, our clinic has received interest from 3 different types of prospective purchasers. Internal staff who really believe strongly in the program, a large multi-regional healthcare agency, and a larger local healthcare agency, all of whom have the purchase goal to grow their school-based telehealth and school-based mental health programs. So we're very excited about all of those opportunities and what it means for school-based health. Thank you.
Thank you, Kim. My name's Eileen Klima, and hello, everyone. I'm going to talk a little bit about agencies in partnership with schools. Different agencies can partner with schools and help alleviate a variety of stressors. One example is our partnership with the Disaster Shock Global Response Team. Disaster Shock is an international humanitarian all-volunteer relief organization dedicated to providing resources to children and families affected by disaster-related stress. 20 countries have come together to extend support and share information. This is extremely helpful in today's world when we are facing climate change, natural and man-made disasters, as Sandi mentioned, on a regular basis. At Saturday's Oxford Symposium, a group of high school student ambassadors will be presenting their work with the Disaster Shock Global Response Team and discussing the future of partnering with schools. And I'd like to turn the time back over to Erin. Thank you.
Thank you, everybody. So we know we covered a lot of ground fairly quickly. We would like to open it up for questions and discussion along the larger group, but we also wanted to include our contact information so that if anybody wanted to contact a certain person with a certain area of interest or question that we cannot cover in the next several minutes of time, you hopefully can either resume or can make contact with us or find this information posted on the website a little bit later. So thank you all for your attention and your time, and we look forward to a conversation and dialogue with you now.